So guys, let's continue with our basic immunology build up. What we want to get to is ARVs. But like I said, is that we cannot talk about ARVs if we don't talk about the virus and the immune system, because this is going to be a very long series, because we're still going to talk about the regimens that are out there. What protocol are we following in terms of initiating patients on ARVs, and what is the first line, second line, third line therapies, and also what other tests must you do before you can start a patient on antiretrovirals. So briefly, we said yesterday that we've got a bone, and inside bone we've got bone marrow, and in the bone marrow we've got hematopoietic stem cells, and those hematopoietic stem cells can either take the myeloid root, myeloid progenitor, or they can take the lymphoid, right? Please watch the first video because this is part 2. I don't want to talk about this today, but I did mention it yesterday. So because this is where we want to be, so let's talk about this. So in the lymphoid side, you can end up getting your natural killer cells, or you can get your B lymphocyte, or your T lymphocytes, right? Your B lymphocytes will migrate and leave the bone marrow and go to the peripheral lymphoid tissue, like lymph nodes, spleen, and others. There they'll become mature B cells, and later on become plasma cells. The main function of plasma cells is to produce antibodies. Okay. On the other side, these immature T cells will migrate to the thymus and become T cells, naive T cells. A naive T cell is a cell that has not met an antigen. It has not interacted with an antigen. So this brings us to the most important part, which we're going to be talking about right now. So guys, there are different types of T cells, but we'll be talking about the CD4 positive T cells specifically here. So the T cells, let's draw a T cell. This is a T cell. This T cell has got receptors. The first receptor is called a TCR, T cell receptor, or a T cell antigen receptor. The second one is a co-receptor, and this co-receptor, let me use a different color, is a co-receptor, And this co-receptor is called a CD4 receptor or a CD4 molecule. It's a protein. And then remember, the main function of T cells is to fight off infection using different methods. On the other side, we have antigen presenting cells. Okay, let me just try it this way. Okay, it's fine. We've got an antigen presenting cell. An antigen presenting cell, also called an APC. That's an antigen presenting cell. An antigen presenting cell, there are different types of antigen presenting cells. Most phagocytic white blood cells are antigen presenting cells. What does an antigen presenting cell do? An antigen presenting cell is gonna, let's say it's like this. Once it sees an antigen in the form of bacteria or a virus, that antigen presenting cell will be activated and end up engulfing the antigen. This is an antigen. So this antigen will be digested by the lysozymes inside this antigen presenting cell and break it into pieces. And then after that has happened, there's a class of molecules called the MHC. Those molecules will take these pieces, these broken proteins, and take it to the outside and present it on its cell surface. And this is the only way the T helper cells will recognize that, oh, we've got an antigen in the body. As long as the antigen is just there, floating in the blood, swimming, and it has not been presented, some cells cannot do anything about it. So most T helper cells cannot do anything about it. They will wait until an antigen presenting cell recognizes that antigen, engulf it, break it down, and take its pieces and express those pieces on its cell surface. That's the only time that these T helper cells will recognize that, oh, we've got a foreign body, we've got an antigen, right? These molecules that makes it possible to present this antigen on the surface are called MHC, or major histocompatibility complex, right? So let's take this and put it next to this now, because now this guy is gonna come and see that, oh, I've got an antigen that has already been prepared for me that I can see. Now let me go and do something about it. Let me go and fight it. So you've got your broken pieces, and then there it is. It's been presented now. What are these antigen presenting cells? Some of them are macrophages. Some of them are monocytes. Some of them are dendritic cells. These are antigen presenting cells. Without them, these guys cannot do anything. They need them to first process the antigen, for them to do anything about it. Okay, this is where it gets interesting. Here you have a TCR, right? And then you've got this CD4 molecule, which is a co-receptor. That, remember, when you've got a main receptor, the main receptor will interact first, and then because of a conformational change, the co-receptor will also get a chance to interact as well. So basically the teaching here is that you have TCRs that are on the cell surface of your T helper cells, which will interact with your MHC1. The class is 1 here. There's class 1 and class 2. And I think this is class 2. You can correct me guys if I'm wrong, but there's class 1 and then there's class 2, which is not really important for clinical medicine. But anyway, now on this cell surface, you've got TCR and also you've got CD4 receptors as well that are co-receptors. That's what I want you to guys get there. So this is where the problem with HIV comes. We are going to talk about the structure of the HIV. The structure, the way the HIV is structured, we are going to talk about it in a bit of a detail though. But the HIV has got glycoproteins, the GP120 and the GP41. We said that the CD4 molecule is a co-receptor that helps with this for the purpose of fighting infection. But it happens that the CD4 molecule, I can say it has got affinity for the receptors in the HIV. So that's why now, so basically the HIV virus takes advantage of the CD4 receptor molecules. So we're going to talk about that in just a moment. There's one thing that sort of like bothers me at times about this thing of CD4 cells. When we talk about CD4 cells, we always assume that we are talking about T helper cells. Yes, that's what we always, when we say CD4 cells, we're talking about T helper cells. But there are other cells in the body that have got CD4 molecules as well. And the dendritic cells, the monocytes, the macrophages, they also have CD4 receptors in their cell surface. But when we talk about CD4 cells, we are always talking about this. So this gives us an assumption that the only cells that have got CD4 molecules are T helper cells in the body, and yet it's not the case. But anyway, let me leave the politics of science.